Dr. Mehmet Oz, good guy, is the Emmy Award-winning host of the Dr. Oz Show. This week, he kicked off his second season by taking his viewers behind the scenes of his routine colonoscopy, which resulted in a kind of surprising outcome. Watch.
You are going to feel this right now. I'm going to go around a corner, okay? We're going around a corner, and this is where you go, going around a corner. And you have a polyp, Mehmet.
Bingo.
Mehmet, you have a polyp.
Yeah.
I mean, I want you to actually own this. Okay, look at that screen. I predict that will be adenomatous, the kind that if you left it in could have become a cancer.
Okay, why were you awake? I've had 4 colonoscopies, never been awake.
I got to say, I'd forgotten that moment until I just saw it again.
I wasn't awake, but I thought I was.
Exactly.
I was awake. I was what? In Never Never Land.
Never Never Land, which some people like to be in for a lot of their lives. Most of us don't like to be there, but they give you a medication that gives you a little bit of amnesia. So you don't quite remember what's happening. So you sort of half dazed. I remember lying on the gurney as this was being done, and John LaPook, God bless him, who's also part of the Stand Up to Cancer event that we're going to be at tomorrow night, was doing the procedure, and he was complaining about my long and windy colon, and it was all sort of, hail and good fellows, and then all of a sudden he saw this lump, and I saw it, and I looked at it, and I was trying to focus my eyes, and I said, that looks like a precancerous polyp, but that can't be me. I don't have a family history. I don't, drink. I don't smoke at all. Not been overweight. How could that possibly be? And then I had this sort of weird, like you're in a car accident feeling, like everything's moving slowly. This kaleidoscope of images, trying to make sense of how could this possibly be.
Precancerous polyps are fairly common, though, in colonoscopies, aren't they?
Turns out about 25% of us when we get screened. But the part that's scary isn't the precancerous polyp. The part that's scary is that if I hadn't gotten this done, and then there's someone watching this show today, right now, who I want to make this clear.
50, right?
If it was over 50, or if they've got a family history over 40, who, if they don't get their polyp screened, they're going to be seeing a doctor in a couple of years with a cancer, because almost all cancers of the colon come from these polyps.
And if cancer of colon's late, you're gone, right?
Yeah, and I've had that conversation. You look someone in the eyes, and you got to tell them, listen, you're going to die from this. It spread to your liver, to your lymph nodes. And if only we had found it when it would look like that one that you just saw in my colon, we could have prevented it.
And you don't like to use the word stupid, but people who are afraid of it because they're going in through your rear and you're worried and you got to take the test and you got a night before you have to have bowel movements. It's a joke. The tests are nothing.
I was checking the box up. I cannot tell you how simple I made it. I wasn't even a good patient. I had lentils.
You were nervous?
No, I wasn't nervous at all. I thought the whole thing was going to be sort of nothing. I filmed it just because I wanted to show how easy it was. That's the whole irony of the situation. And I have to admit this. In fairness to Dr. LaPook, he was busy squirting off lentils from my colon because I had lentils the day before. I was really hungry. I thought, no one will know.
You didn't get it all out.
Didn't get it all out. And so I am, as a fool, going through this process. And then I thought to myself, do I tell people about this? And I thought, if I don't tell people about this, there's going to be someone out there who looks and feels like me, who doesn't realize that you can have no symptoms, because usually you don't, and is not going to get this test done.
Katie Couric did her own on television, too.
Katie Couric did it. There are many folks who...
So what we're saying, let's be explicit. If you've had family history, start at age 40.
Right.
A regular 50, and usually do it every 3-4 years.
Once you've had it once, you don't have any polyps, you can go 10 years. I have to do it a little more commonly now because I have this polyp and I could get more of them. But once you've been screened every 10 years. And Larry, the key thing about colonoscopy is, unlike other tests where they just tell you got a problem, they cure the problem with colonoscopy.
Okay, yeah.
It's right then, it's finished.
And male and female.
Male and female. And please, there's another big mistake. See a number of men as women die colon cancer. It's not favoring one sex or the other. Everyone needs to be screened.